Alzheimer's disease affects more than 5 million Americans, with an additional 10 million in early stages and not yet diagnosed. Research has yet to find a cure, but prevention might be the key to minimizing the risk of this devastating disease. Dr. Bradford Frank, author of the book Alzheimer's Disease: The New Prevention Revolution, reveals steps to take control of your health.
Alzheimer's is a type of dementia, the most common type of dementia. It affects the memory, which is what people usually notice first, but then it moves into dysfunction of the remainder of the brain, the areas where you think, where you do calculations, what we call executive functioning. The current treatments for Alzheimer's disease are basically medications that affect the acetylcholine in the brain. These medications will slow the decline, but they don't reverse it. They don't help your brain stay the same, and they certainly don't improve your brain function.
Dr. Frank discusses strategies that can decrease the risk of Alzheimer's disease.
There are 7 interventions that we can make to help prevent Alzheimer's disease. The first way is to take a look at our attitude. Do we have a positive attitude in life? Do we have a purpose in life? And how do we deal with stress? A little bit of stress is good, but too much stress is bad. It can actually interfere with memory. Secondly is diet. And when I'm talking about diet, I'm not referring to weight loss diets. We're talking about diet and healthy diets. Eating fruits and vegetables, staying away from red meats, and dietary products, which when they're metabolized can cause harmful metabolites that actually help lead to heart disease and dementia. Eating things like walnuts, olive oil, and you may have heard about drinking wine. You can drink wine, red wine, but not too much red wine. The third area where we can make significant interventions is exercise. There are 4 areas that you need to concentrate on. One is strength, second is stamina, third is balance, and 4 is stretching. 4 is mental and social activity. Things like learning a second language, playing bridge, working puzzles, using your mind. Also socializing has been shown to help prevent Alzheimer's disease. Number 5 is preventive health care. Things like getting mammographies, colonoscopies, for males, a digital rectal exam, and PSA, vaccinations. If you're over 65, you need to get actually 2 vaccinations for pneumonia. And also oral care, maintaining good oral care, brushing your teeth twice a day, flossing, and also eye care. You need to maintain those preventive strategies. Number 6 is sleep. A lot of recent studies show how important sleep is. It's absolutely critical to overall health and certainly in helping to prevent Alzheimer's disease. It would be best not to use over-the-counter sleep agents, which actually can impair memory and have other negative consequences as well. Number 7, there are medications and supplements that can help prevent Alzheimer's disease. Medications such as antihypertensive agents, antidepressants, and even lithium. Supplements include things like berberine, which is an antioxidant, vitamin B12 and other B vitamins, CoQ10, which actually gets into your mitochondria, which are the powerhouses of the cell, which is very important. If you don't eat a lot of fish, then you need to take omega-3 fish oils. Green tea actually decreases the fat around your intestines, so-called visceral fat. Visceral fat secretes harmful things for your body, for your heart, and for your brain. So taking green tea is a very powerful intervention that you can do. Other things include turmeric, which is yellow spice, and that's one of the reasons that they feel that Indians have a lower incidence of dementia. There is no magic pill for Alzheimer's disease. However, there are the 7 preventive strategies that I've just outlined. They are in my book, Alzheimer's Disease: The New Prevention Revolution.